agenda for the briefing meeting. Okay, then the items we just covered will constitute our agenda for this meeting. Do any commissioners have any questions about any items on the regular meeting agenda tonight? Very good. All right, then let's get started with a COVID update, and Stacy Saunders is here to help us on this item.
Thank you, Commissioners, for the time today for this update. The metrics continue to improve overall. There continues to be a clear decline in new cases from week to week. You can see that on your screen, on your TV screens, that we've seen a marked decrease from the peak. Since January 18th, there has been a 67% drop in new cases per 100,000 per week. The current new case rate is 386 new cases per 100,000 per week. Additionally, the percent positivity continues to decline and has fallen from 19.6 last week to 15.5 this week. This is just over 4 percentage points drop in 1 week. Deaths, unfortunately, have increased. 21 new deaths were added to the dashboard. However, only 9 of those actually occurred in the last week. The remaining deaths occurred in weeks previous but were delayed in being reported. But this has caused our death rate to jump to 8 new cases per 100,000 per week because of those delays. As mentioned in previous weeks, it is likely that the death rate will fluctuate for several more days, even weeks, as deaths continue to be the most lagging of our indicators. Hospitalization and our hospitalization indicators are now both very favorable. Regarding what you're seeing in front of you now is regarding the entire Western North Carolina region. Hospitalizations and ICUs continue to decline. Within the Mission Health System, there has been a considerable drop in inpatient hospital beds occupied by COVID-19 in the last week. Last week, this indicator was 13.4% of the inpatient beds occupied with COVID-19. Now we are well below 10% at 8.8%. As of Monday, there were 104 total patients with COVID-19 within the Mission Health System. This is down from almost 196 patients about 3 weeks ago, which appears to be probably the peak for that indicator. ICU utilization continues to decline and is now well below 30%. We are around mid 25%. So though the colors in this metric table, the upper tier, are still in alert, we continue to be on a favorable trajectory in terms of the Omicron surge. As I have said previously, we have approached 2022, and once we entered into the new year, there are key thresholds that help us usher in a new chapter, new phase of the COVID-19 response. In particular, as vaccine, we have approximately 70% of our eligible population having received their primary series, what we know is fully vaccinated, and 56% of those individuals that have received full series have also received a third or booster dose. Vaccines continue to demonstrate effectiveness in preventing infection, severe illness, hospitalizations, and deaths. And in addition, evolving treatments and therapeutics continue to grow in supply and access. These treatments also help in reducing severe illness, hospitalizations, and deaths in individuals with higher risk. As anticipated, the pandemic landscape continues to change, and as such, the pandemic response evolves. With the face covering requirement expected to expire on Wednesday, February 16th, Public Health will now move to providing general public health recommendations at this time, given the rapid and expected to continue decline in cases, transmissions, and hospitalizations. Included in those public health recommendations, we'll be strongly recommending that individuals continue to wear masks and face coverings in indoor public spaces. With or without a countywide face covering requirement, layered approaches continue to help reduce the spread. In addition, these measures work best when working together: vaccine, masking, testing, and staying home when sick. We've learned what things we can do individually to help protect ourselves, and as the surge dissipates, individuals can continue to utilize these effective tools while assessing their risk for exposure. I did want to talk a little bit more about the vaccine efforts. Vaccine and vaccination continues to be the priority tool for prevention. We currently have 72% of our eligible population having received at least one dose, and approaching that 70% of that eligible population receiving their full series. Vaccine uptake has slowed. I did mention that the last time, but we do continue to see countywide 200 to 300 net change in doses administered each week for the last few weeks. Each dose is helping to build a stronger shield of protection from COVID-19, especially against severe illness and hospitalization. I did want to share the hospitalization and ICU data that we have statewide. Vaccines are continuing to demonstrate their effectiveness in preventing infection, severe illness, and hospitalization and death. Almost 70%, if you look at the top, almost 70% of all hospitalizations are in unvaccinated, while the risk is much lower in those that are fully vaccinated, and even lower in those who are fully vaccinated with a booster. This trend holds true for ICU utilization, where just about 73% of ICU COVID-19 patients are unvaccinated, with far less ICU burden in those who are vaccinated and vaccinated with a booster. So for our community that's listening in, if you or someone you know wants their vaccine, you can still visit us at the health department at 40 Cox Tuesday through Friday, 9 to 4. Buncombe County HHS will move forward with transitioning our 40 Cox, our smaller mass vax clinic, into the existing immunization clinic by the end of February, now that our less than 5-year-old vaccine authorization looks like it's going to be delayed for a couple months. Buncombe County HHS and Buncombe County Emergency Management have been bringing in the new year with several school-based initiatives for vaccine. Our event at Asheville Middle was the most attended, with over 90 doses administered, followed by TC Robertson, where we administered over 30 doses. And we closed out that series at North Buncombe High with vaccinating just under 10 individuals at that event. With the demand for mass vaccination community events waning, Buncombe County HHS will be looking toward more of that equity-focused vaccine events that I've been talking about for several weeks, partnering with existing and new community organizations with this shared mission. For example, I have on here that on the horizon we are currently planning an event in March with Healthier Together, YMCA, and the Mexican Consulate to hold a vaccine event. And as always, just want to take a moment to remind everyone that there are numerous vaccine providers in our community. Some of them are quite literally just down the road from you or right in your neighborhood, and you can visit the ncdhhs.gov/vaccine site, or just simply Google North Carolina, find my spot, find my shot, to find a vaccine provider near you. And as I wrap up today, there are some key messages for the community to remember. Again, we are experiencing a rapid decline in cases, transmission, and hospitalizations. It appears that we are seeing that decline in that Omicron curve and that Omicron surge. As the surge continues to decline, we are now moving into strongly recommending individuals continue to wear masks in indoor public spaces. Again, if you are exposed to a known positive, consider getting tested. If you have symptoms, stay home, seek provider or community testing. If you are infected and are high risk for severe illness, talk to your provider or visit the Find Treatment website. And vaccines, again, just want to close out by saying vaccines are working to prevent severe illness, hospitalizations, and death. Please consider getting the dose that you are missing today, whether that's your first, your second, or your booster. And I wanted to thank you all very much for your time today and welcome any questions.
Thank you, Stacy. I have a question. So looking at the data you gave us, so only 56% of the fully vaccinated have received their the third booster, or the booster, which is the third. And when I look at the hospitalizations and the ICU numbers, if you've had the booster, I mean, it is dramatically decreasing your chances of ending up in the hospital or the ICU. And so, and it seems like that group of people, right, they've already had vaccines. So it seems likely to me that they would be open to having the third. And so I'm wondering, is there anything that you're seeing or you're thinking about that we can really do with outreach to that group to increase their uptake of the booster, because clearly we're seeing that helps.
Absolutely. So thanks for the question and the inquiry. So I think, one, as I said a couple weeks ago too, I do think we are seeing that vaccine uptake wane a little bit. I do think some of that was that we had the holidays, folks were still in that holiday mode, and just getting back on track. So lots of competing interest. So doing a lot of our messaging around Give Your New Year a Boost, helping folks understand that the importance of boosters, and actually doing some community group types of talks around just COVID in general, but definitely hitting that it's time to get a booster if you're eligible. We've had, not everybody's going to be eligible for a booster yet, so we want folks to remember that as you approach your eligibility, there are several providers in our community. So we continue to, and will continue, that will be sort of our goal for 2022 as we approach 2022 and came into it, was really about our whole campaign around Boost, Give Your New Year a Boost. So hopefully continuing to do that with our social media, our new visuals, the revamping of our 3 Ws bear, and some community-based discussions or presentations to help with that.
I guess kind of related to that, I mean, I realize what we do in one community, we can't establish the language for how we talk about all this stuff as a country, right? I mean, there's sort of the national terminology that's being used around this. But, I mean, in a way, to Commissioner Wells' point, I mean, in a way, it almost seems like it would be maybe preferable if the language around this word, like, you need to have 3 shots if you want to be considered fully vaccinated, right? We talk about people being fully vaccinated, but in the reality is that, at this point in the development of the medical treatments, they're really not fully vaccinated. In that, I think there's this perception among even a lot of folks who've been vaccinated that it's kind of this nice to have, but you don't need to have it kind of thing if you've had the first 2 shots. Whereas, as we've learned more about this, we see what a really significant additional layer of protection the 3rd shot does provide. So anyway, I know we're not setting the national narrative around how these things get discussed, but it really is, seems so important that folks go ahead and get the 3rd shot.
Thanks for that comment. Absolutely. It is very important that if you are eligible for your booster, that we are seeing time and time again, vaccine is demonstrating its effectiveness. You're right, we don't get to control sort of like what's called fully vaccinated right now. That language is still as is for the 2 series, although there has been a shift in that language, at least at the federal level with the CDC, that now to more talk about up to date. Are you up to date with your COVID-19 vaccine? That would be much more encompassing of not only did you get your full series, and if you're eligible, did you get your booster?
Parker, do you have a question?
Thank you, Stacey. I had 2 questions from constituents that I wanted to ask you. One around masks and one around children and vaccines. I guess, as I think we all know, the federal government has provided some free N95 masks through various pharmacies and those kinds of locations. Someone was asking me if there's a way, without calling every pharmacy in Asheville and asking them, is there a way to like look up what locations people can go to get those federally funded free masks?
That's a great question. I will get back to you on that
Okay.
one. I do not know off the top of my head if there is a place, a single place where, a single source where you can find that.
Okay. And then my other question, around the disappointing news around the 0 to 4-year-old vaccine situation. I think when we thought it was coming, someone was asking me about, where people can go to get those shots. And I guess I just wanted to ask is it your expectation that most people would go to a pediatrician's office to get that vaccine? Would our health department be involved in giving out those vaccines? What's kind of the general plan for when that does come?
Sure, thanks for that question, because as we were anticipating that happening, we already started planning not only at a state level, but at a local level. And that I can tell you that the anticipated plan, if it doesn't change from what we were expecting before it got delayed, would be that yes, lots of vaccine going to what we call medical homes or pediatricians, where you've already got a trusted relationship, where your child already knows their provider, and also for local health departments to be a primary place for vaccination. Mainly because in the more recent weeks, our retail pharmacies have been doing lots of vaccinations. But the PrEP Act doesn't allow for the pharmacist to vaccinate anyone younger than 3, so 3 and younger. So we're going to miss a chunk of that population. And so we do anticipate that local health departments around the state are going to act as a safety net when the 0 to 4 are eligible. And for us, we had delayed our transition of the 40 Cox smaller mass vax clinic in anticipation of the 0 to 4, and now that we're hearing that delay and that it's likely probably April, we will go ahead and transition that, and then as we approach that eligibility, likely plan either a special event or some type of special setup to help meet that need.
Thank you.
Stacey, I want to follow up on the slide that you showed of hospitalizations for unvaccinated folks. I can see on the NCDHHS COVID dashboard that 4% of hospitalizations are under 17. Do we have any kind of breakdown on the under 4-year-olds that can't be vaccinated, and are they being hospitalized? Are we seeing any kind of correlation with age and vaccination status?
Thanks for that question. I don't have that data with me today, but happy to pull that for you as much as I can at a local level, and then at least at the state level so you can see that. We'll be glad to share that with you.
Thanks, Stacey. No rush. I appreciate it.
All right, if there's no other questions, Stacey, thank you for the update and for all the good work from all the folks on your team. We really appreciate it. Commissioners, related to this, I was reminded for the regular meeting this evening, we do have a discussion of the indoor mask policy on our agenda. As Stacey mentioned, it is currently scheduled to expire on February the 16th. So as part of that, we should also discuss the local emergency order that was put into place. It doesn't cover just the indoor mask policy. It's sort of larger than that. But we should, if there's consensus to agree to that, we should have a discussion about that as part of our discussion of the indoor mask policy too, because they're kind of related. And Avril, do the staff have any language that you would have ready or prepared, Mr. Frew, related to that?
I didn't get this to you, Mr. Chairman, before the meeting, but if the board does decide to let the local mandate expire at noon tomorrow, then it would be in order to add an agenda item to specifically rescind the local state of emergency. That was just activating the emergency action plan, so it'd just simply be a motion to, if the board decides to rescind the emergency action plan in the local state of emergency.
Okay, So we could adopt that, that language that would rescind the local emergency declaration.
Yes, sir.
Okay. Is there consensus to include that in the discussion this evening? Great. Thank you. And there was one other question that someone asked me. So assuming that the indoor mask policy expires on February 16th, that still allows individual businesses and organizations who wish to continue to have an indoor mask requirement for their own facilities to make that choice. Is that correct?
That is correct.
Okay. I got a phone call from Judge Alan Thornburg, who just wanted us to mention that the courts remain supportive of having an indoor mask policy for the courts. They feel like it's very important. You know, when folks have to report to court, it's oftentimes not something that they have the choice of whether to do or not. They're required to do so. And so he shared that the judges believe that it's, you know, first of all, very important to try to do everything we can to keep COVID out of the detention facilities because it's a confined, close quarters environment. And because, again, people, it's not a place where people completely have the voluntary choice of whether to appear there or not. So they feel like it's important for the time being to keep that policy in place and wanted us to just share that that's their intent. And I want to make sure we're not going to adopt anything that would be inconsistent with allowing them to make that choice, just as any individual business owner could continue to do so within their own private property if they choose to do so.
And I would add, sir, not just business owners, but offices or government offices as well, because we would want to keep it in place in some of our locations as well. So give us the opportunity to just not, it would be for the public that they have the option, but individually we can set that policy for our own locations.
Okay. And are the staff prepared to share some information about what facilities they would be planning to do that in at this time or at the meeting this evening?
Yes, we were thinking a 5 o'clock conversation, but specifically our libraries will be one that we want to make sure, because that is an in and out conversation on a daily basis, and some of our public health locations. So we want to make sure that we keep those in place in those locations.
Okay, so yeah, let's please just review that at the meeting this evening so that we make sure the public is aware of, you know, what to expect going forward. Okay, all right, thank you, Stacy. All right, next up on the agenda is an update on the Inca Sports Park Turf Project. Tim Love is here to help us with this.
Good afternoon, commissioners. This afternoon, we're going to present an update on the Inca recreation destination, specifically the sports project. I'll be leading our discussion with some slides, but in the room also have Lynn Pegg with Recreation Services, as well as Ronnie Lunsford with our General Services Department, who are available to answer specific questions that I can't. So getting into sort of the presentation today, just a refresher for the board, but also the public. The Inca Recreation Project is a big project. It's got a lot of different components, but in general, seeks to expand recreation, sports, and greenway projects, while increasing connectivity between a number of institutions in Inca. And examples of those are the Buncombe County Sports Park, the Bob Lewis Sports Park, some of our educational institutions like AB Tech and Inca Intermediate, and then the Inca Commerce Park, which is home to almost 1,000 employees. This project was developed in 2018, earlier likely, but was estimated to be a $12 million project, funded almost 100% through grants. And those grants came through the Federal Highways, DOT, as well as the TDA. In particular, in October 2018, the TDA announced an award of $6 million in grant funding towards this project, based largely on the installation of turf and lights that would generate room nights on an annual basis from sports, recreation, tourism. The project began in September of 19 and then was estimated at that time to be completed by September 2022. But as we know, much has happened since 2019, namely COVID and many other things. As a refresher, this is an overview of the project, and I'm not going to call out all the different aspects of it, but there at the top right corner, that's the sports park. Immediately to the south of that, you can see Bob Lewis Ball Field. To the left of that, that's of course Inca Commerce Park. And, we have callouts for all of these different sort of amenities that came together to create the Inca recreation destination. Additionally, you can see the blue line that indicates Hominy Creek, and just below that, a pink line that indicates an older alignment for the Inca Heritage Trail, which is a 2-mile greenway that we are still actively pursuing, but that alignment has changed based on our design work. In the Inca Recreation Destination Project, there are a number of key components. I won't read all of these to you. The key here is to know that if it's on the screen, generally it was included as a grant commitment to the TDA when we pursued that funding. There's a couple items that were not grant commitments, but I called them out because they're important as we think long-term. And so those two, you can see them in bold, and they say no in the grant commitment column. That was the installation of a water line and a future restroom near fields 7 and 8 at the bottom of the sports park where we'll be doing the turfing. Additionally, the creation of a parking lot on Warren Haynes Drive, which would be the future trailhead, or one of the trailheads for the Inca Heritage Trail. So 2 items that were not considered, but have come to our attention since, and just wanted to call those out. Just to give us some context of what the fields look like on the left, these are your current Buncombe County Sports Park fields, just a couple of them. You can see that they're grass, and you can tell that they're grass based on the color. Our intent here is to make these turf fields, and the benefit of that is, when it rains, we don't have the impact of mud that you see kind of on to the left. But as part of this project was also the installation of lights. And so these LED lights allow us to play for longer in the day, not into midnight, but of course once the sun sets, into the early hours of the evening. These 2 things mean that we'll be able to play more frequently when the weather isn't awesome, but additionally play later into the day when the sun sets. A few site designs here, just to give you a sense on the right of what the schematics look like. We've been working with a design firm and an engineering firm to come up with these specs, and so just a visual for you. So what we wanted to do today is, one, update you on, as a reminder, this is the project, but let's talk a little bit about where we stand with project funding. And so as an update, this shouldn't be a surprise to us. This project was conceived in 2018, so over 4 years ago. That's when a lot of our estimates came together. We've seen a lot happen since then, and a lot of what's happened is increased our costs. And so in general, costs have increased since the initial project estimate was developed over 4 years ago, so you would expect some change in that. But also, as we move forward, we learned that there were additional costs that we hadn't thought about. And a lot of these costs, we couldn't have thought about because there was no way for us to know that the tree ordinance in the city of Asheville would change, or that stormwater requirements would change. And these are just natural changes that occur in a project, but they do have budgetary impacts. And so I put those out there just as examples. Additionally, COVID. We know that that's been a challenge for us, and the resulting impacts, staffing shortages, supply chain, result in additional costs on lots of construction projects, not just related to this one. Insufficient revenue. So on the bottom left, Buncombe County has already put $430,000 into this project to support things like the creation of a dog park, as well as bringing in 3-phase lighting to enable the lights that'll ultimately light the park. We've also brought in transportation grants for the construction of the greenway, but these are restricted funds. We can't just move these around. These are for the greenway specifically. So what that brings us to is, the third bullet, which is the remaining revenue, which is in the form of the TDA grant of $6 million, is insufficient to cover some of the increased costs that we've seen for the project over time. That said, if we look to the right, we still believe that the core grant requirements can be met. The core grant requirements, from our view, it's the installation of the turf and lights that ultimately increase the playable hours at our Buncombe County Sports Park. We believe additional funding may be available, but we think we also need to take a closer look at some of the extraneous projects that were included in the overall grant. As a note, this is a reimbursable grant that'll be paid out in thirds over the life of the project. So that's kind of the narrative, but I want to look at some numbers. So we're going to jump into the next slide and start looking at a table. I don't mean to get you totally up to speed on all of these numbers, but just to give you a sense of how things have changed. So on the far left, we've got costs, and you can see, the design build for the turf. You can see lighting from Musco. Column to the right of that is the original estimate. So these are original grant estimates. And as we said, those were in 2018. As we look at the current estimates now in the year 2022, we've seen a change. And so in the far right column, you can see what that variance is. And so you begin to see that we've taken a hit in some places, in particular on turfing. However, we've been able to sort of move some funds around in other places to sort of save funds. So you can see soccer field lighting, we moved some funds around and reallocated about $300,000, which was then put into Bob Lewis and other locations. If we shift down to the revenue section, you can see the different sources of revenue. So the TDA grant at $6 million, the transportation funding, which is again restricted at $6 million. And then you can see our original estimate was 0 county dollars to be put into this project. If we scroll to the right, you can see those grant numbers haven't changed at all, still steady at $6 million. The counties increased their portion to about $430K. If we bring it to the point, so what's the difference between our costs and our revenues? You can see that number at the very bottom. So as we look at our total revenue less our costs based on current estimates, there's a shortage of about $716,000. And this is to meet all of the requirements in the top of the cost section. So to deliver turf, lights, and those types of things. If you look at the original estimates, at this point we were supposed to have about $1 million still kind of socked away for the remainder of the project. Shifting to the budget overview and kind of continuing the discussion to talk about the other items in the grant that we're committed to. Here you can see additional costs, items like a challenge course, multi-sport field, paving, accessibility upgrades, things like that. You can see what the original estimates were, what the current estimates are, and again, the variance. If we get kind of to the point, this brings us to a total cost of about $14.98 million, with about $12 million in original grant revenue, creating a gap of about $2.5 million. So I'll walk you through this just to understand kind of where we are with the costs, the original estimates, where we are with the current costs, and to understand some of the gaps in funding. We prepared this for you to get you up to speed. This is briefing, so there's not meant to take any action, but we wanted you to understand the context. As we shift forward, I'm glad to take any questions, but we wanted to get to kind of a recommendation and next steps. Again, not asking for any action from the board, but just sort of setting the stage. The recommendation from staff would be to allocate Buncombe County funding to complete the Buncombe County Sports Park turf project. So this is an estimated gap of about $716,000, give or take. By doing this, we would provide the funds to execute the contract with AstroTurf, which would allow us to start the project in mid-March to April, and hopefully have it concluded, weather permitting, by September of this year. So September 22, being able to play on those fields. In the meantime, as we do that, we believe it's important to look at the remaining projects and with the board understand which projects outside of turf, lights, et cetera, do we want to pursue at the sports park. Some of those projects are still possibilities, others may not be based on additional information we've gathered, but we think that's an important discussion. Finally, we want to make sure we're pursuing other funding sources. There is an MPO cycle coming up in the near future, and it might be a consideration to pursue Inca recreation funding for the Inca Heritage Trail, but those are discussions we can have. In terms of next steps, today's the briefing, so we wanted to update you today just to give you a base understanding. Our recommendation would be to come back on March 3rd to approve a budget amendment based on that recommendation to keep this project moving forward and allocate those additional funds to allow us to complete the turf project. If all goes well, we would start construction in April 2022 with an estimated completion of September 22. So, Final slide, and then I'll open it up for any questions. Just wanted to put some numbers behind the recommendation. And so on this slide, it's same table as before, but I've highlighted here the turf and light costs at the top. And so I've highlighted at the bottom the difference. So when you take those amounts in the top cost section, it comes to about $6.7 million, of which we have $6 million in TDA grant revenue, leaving that balance at the bottom of $716K. That's what I have. Do y'all have any questions?
Yes, thank you. So the AstroTurf is almost $2 million more. I mean, and just since 2019, it's increased.
That's correct.
I mean, that's almost doubled the cost of that. That just seems really out of proportion in that short a time. I mean, I understand that lots of things have gone up some, but that is very significant.
It is. There is no way around it. And, we spent a good amount of time with AstroTurf, and Ronnie, you're welcome to join me on this discussion, trying to whittle away at costs to make sure that there was nothing extraneous. And the reality is, this is a market where there aren't many vendors, and AstroTurf is the primary, and these are the costs. Is there anything you'd add, Ronnie?
No, no, nothing really to add. I think Tim hit it on the head. We've sat through countless meetings with these folks and tried to value engineer items out and still get the product that we want at the cheapest cost we can. And that is the minimum we have been able to get it to through those processes.
And so, was the first quote accurate and it just really has increased in price that much, or was there some issue with the original quoting out or pricing of this project?
I think we learned some things. To give you an example, there are additional costs that we picked up along the way, not just related to turf, but stormwater requirements. We currently have a paved parking lot there, and to expand that parking lot to make it larger, we ran into some stormwater requirements that are city requirements, and that's not a criticism, that's just the reality, that weren't initially projected in the costs. We were under a different set of guidelines, and that happens. Additionally, the tree ordinance is another example. The preservation of trees in the parking lot, even though we're in a park, created additional costs. So there's a number of little costs that added up to be bigger costs over time.
Thank you.
Have we begun conversations with other project funders about their ability to help support these costs?
We have, no doubt, and I'll be providing an update in the near future on this project to the TDA as part of their reporting cycle. And they have an upcoming grant cycle. Our recommendation to staff, however, is to proceed to keep this project moving. It's been 4 years since we started, and we have an opportunity to move forward with AstroTurf and bring these fields online this fall. And so our recommendation, if the board is willing, is to proceed with that.
Commissioners, putting turf there and lights would also help us to give more playing time, especially when you heard last time about ABYSA as well as Shield. This gives them more playing time on those fields, and we can really help to spread that load out, and we can help to accommodate both teams.
And a concern I have, if we don't proceed now, when I look at what's happening with inflation, the cost is just going to continue to increase.
That's correct, and I can't project what that'll be.
Right.
But it's true with anything, and
All right, commissioners, any other questions? All right, Tim, thanks for the update. Next item is pre-K expansion updates. And I think Rachel Nygaard's going to help us with this item.
Good afternoon, Commissioners. Rachel Nygaard here, joining you today to talk about pre-K expansion. We shared a copy with you of a new report that has come out. Looks like this. Hard copies went to all the commissioners, and we have hard copies in the room as well. And today's conversation is to talk about the launch of this report and speak about the potential for a pilot to implement the recommendations from the report. I think that's what Avril was eyeing me to be more clear. So I came and met with the Board of Commissioners in December, on December 9th, and gave some background about the Early Childhood Committee during your budget retreat. So I won't back up and share some of that history and the makeup of the committee and the impacts to date, but just grounding this conversation, picking up where we left off with that discussion. The overall reminder here is that we've been making significant investments and scaling up the work supporting the early care and education system in Buncombe County, and are moving forward now toward a pre-K expansion in addition to that continued work in early childhood education. Here's a timeline of what expansion has looked like over the last year. This timeline starts all the way over on the left. On January 5th of 2021, Commissioner Beach Ferrara, who serves as the chair of the Early Childhood Committee, presented to the board about elevating and expanding pre-K in Buncombe County, and the board agreed that the board would like to receive recommendations from the Early Childhood Committee around what that expansion could look like. We then formed a subcommittee, an ad hoc work group of the Early Childhood Committee that met and studied data and models and came back before the Board of Commissioners on June 1st of 2021 and shared what that recommended direction looked like. And then we worked over the course of the fall from July through December with a partner organization to take that recommended direction and submit specific implementation recommendations and strategies. So we've got that report in hand now, endorsed by the Early Childhood Committee, and are bringing it forward to the overall board for consideration. So the ad hoc work group, I mentioned that they studied data and models. Really, everything was on the table during that stage, from narrow program-specific models to very broad universal pre-K implementations. And the committee landed on the following recommendation or recommended direction, which is to establish a local model to supplement and expand the NC pre-K program to increase kindergarten readiness. Quick background on the NC pre-K program. Pre-K in general is tested and proven to have returns on investment for communities. NC pre-K in particular is also proven high quality and effective, including a study that came out in 2016 from Duke University showing the impacts to children who participate in this program on grades and grade level promotion, etc. This is a state-funded program that serves 4-year-olds from income-eligible families as well as 4-year-olds that have additional risk factors that might include developmental needs or disabilities. This is a free program to eligible families that follows the school day, school year, or 10 months a year, 6.5 hours a day. And it's offered in a variety of settings, from public to private. Snapshot of what North Carolina pre-K looks like in Buncombe County currently. There are 442 slots. That's a word that's used in this field a lot. That's seats or children served in 49 different classrooms at 29 different licensed sites through 8 different providers or private or public organizations that are delivering NC pre-K in Buncombe. That equates to 35% of eligible children served. The ad hoc work group chose the recommended direction building on some work that had come out of an initiative called My Future NC. Land of Sky Regional Council had an NC pre-K committee that studied and adopted these recommendations, which statewide look at trying to increase that participation in NC pre-K up to 75%. So you remember that I was just saying that we were at 35% in Buncombe. State average is 51% currently. And so if Buncombe were to scale up, it would be an additional 769 children or seats or slots in the program. The catch is that there's a lot of barriers built into the system as currently designed. And if given by the state an additional 769 slots of funding, we wouldn't be ready to scale up and implement that expansion. The barriers here cover those barriers that providers experience, so barriers to providing, as well as barriers to families in accessing the program. I'll do a quick run through of these. It starts with cost. There's an inadequate per child reimbursement rate. A North Carolina Department of Public Instruction study quantified the reimbursement rate around 60 or 61% of the cost of actually delivering or providing the program. There's a lack of pay parity between NC pre-K teachers at different sites and between NC pre-K teachers and teachers in the K-12 system, and that creates a lot of volatility and movement and turnover. There aren't ramp-up supports for new providers to enter as an NC pre-K provider and meet the stringent level of requirements. They're expected to comply on day one, which makes a barrier to entry. Insufficient administrative funding almost minimizes the important things that can't be covered because that funding isn't there, which would include coaching and training and support for those administrators and educators. And then there's a few barriers listed here that families experience. The fractured systems, figuring out who has a slot open for my child to attend, how do I enroll and navigate these systems. The school day, school year, that's tricky if a working family is trying to pair NC pre-K with a full-time job. And transportation is a barrier that comes up very frequently as we listen to families. In addition to asking the provider that we contracted with, which is Buncombe Partnership for Children, to address those barriers in their recommendations, we also asked them to consider these key elements which were defined by the ad hoc work group and the Early Childhood Committee. Making sure that the strategies coming forward in the report are diverse and inclusive and equitable, that high quality is built in to the model recommendations, that we consider access for all, as well as the reflective of what families and communities express they need. Focused on and grounded in data, appropriately financed, and very importantly, responsive to changes within the early childhood system. It was not lost on the Early Childhood Committee that during this time of research about what do we do here locally, there are conversations happening at the state and federal levels about scaling up pre-K. And so whatever we do here, it was important to that group to make sure that it's responsive to any changes at other levels. So the report, we have the report in hand, and it was produced by Buncombe Partnership for Children. That's the sort of the system coordination nonprofit for early care and education in Buncombe. And they were contracted by the county to produce this report and did so in collaboration with Asheville Buncombe Preschool Planning Collaborative, which is like a planning collective, as well as others. The report includes 6 strategies that were endorsed by the full Early Childhood Committee earlier this month. And anyone following along that wants to check it out, it's at buncombecounty.org/pre-K report. So this is the meat of the report, and I'm gonna pick it up and reference it as I speak, not to go into a lot of depth about each recommendation, but if you look at the yellow or the greenish recommendations across the top, those are the recommendations, the strategies that address barriers to providing NC pre-K. And the strategies on the bottom row that are bluish green are the strategies that are responsive to the barriers to accessing, barriers that families experience. The first strategy is the strategy that would call on Buncombe County to act in an expanded and new way beyond what we've tried before, which is to use local funds to subsidize the state's inadequate reimbursement rate. So essentially providing a local supplement to the rates built into the NC pre-K model. There are other components of that first strategy, like requiring pay parity and requiring minimum wage, living wage as a minimum for teacher assistants. And including some of that coaching and those components I was mentioning that administrative costs don't currently cover. The second box, the one in the middle on the top, is around the career pipeline. When we look at what gets in the way of expanding early care and education in general, and certainly NC pre-K, it's a workforce shortage. It's a lack of qualified teachers working in the field and other staff to work in the field. And so we have been doing strategies through the regular grant program, the early childhood education grants, focused on workforce, and this would be a scaling up of those specific strategies around supporting existing teachers to continue their education and achieve the certificates that are required in the field, as well as the degrees and a licensure for this education and career pipeline. The third box, the third strategy, is around ramp up. I mentioned that to become an NC pre-K provider comes with a lot of requirements, and so this would provide coaching and instructional tools and professional development for organizations to get accustomed to using all of the instructional and curriculum and evaluation and reporting components that would be required to begin being in and delivering NC pre-K. And then the bottom three, like I said, are about families. Coordinated outreach and enrollment is about scaling up the single portal of entry so that there's a streamlined single place that people can go to learn about opportunities to sign up for and participate in NC pre-K. Wraparound care is to both pilot and study what can be done to add time to the NC pre-K day and year. So that's a year-round program and maximizes what other lines of funding are out there. So we know about child care subsidy. That's one of the sources of funding that sometimes gets paired with NC pre-K, but not all families that are eligible for NC pre-K are eligible for subsidy. So when we say wraparound care here, we mean longer school day and an opportunity to attend more days in the year. And finally, expanding access to transportation. There's a couple of specific strategies to both test and evaluate transportation for families to be able to get their children to and from the NC pre-K program. I didn't hear you.
Could you just maybe share a little bit more detail about what those strategies are?
Certainly. So the transportation options are on page 37 in the report. And one of the ideas is to provide direct funding at a certain amount, which is $100 per month for 45 children, to allow families to arrange their own transportation. So they would identify what people with a transportation barrier would identify a solution that would meet their need and be able to basically be eligible for funding assistance to be able to get that individual transportation. That's an idea that infuses more flexibility. When we think about the family and community voice, the feedback, not everybody is, the same solution won't work for all folks because they live in different areas, and purchasing a van and driving it around and getting students to their pre-K programs isn't necessarily as cost effective. And so the idea of testing this model, but also conducting a demand and feasibility study related to preschool transportation, because what we have right now is a lot of anecdotal information. And so really getting back to being grounded in data, making sure that we have our facts about both the needs and the options. And then that would link to the single portal of entry so that parents could express their transportation needs and hopefully get linked to solutions that work from them right from the beginning. So I have another important slide I want to pull back up, Max, which is the cost. This is a snapshot of what it would cost to test out all of these strategies over a 2-year period. If we were to implement a 2-year pilot, the fully loaded cost, including governance, administration, and evaluation, is $3.2 million, and that's itemized on the slide. And there's more detail in the report. So I am going to pass shortly to members of the Early Childhood Committee. But first, quick summary. This lines up with the county's strategic goals around kindergarten readiness and around addressing educational disparities. We think that building on the NC pre-K model as the method for expansion in Buncombe County brings that quality and brings that responsiveness that's important to any changes that might be coming at state or federal levels in the future. A pilot method of implementing this would give the county an ability to test and evaluate and see if these strategies are effective. And in terms of timing and readiness, we could begin launch of a pilot as early as July 1st of 2022, in just a few months, if we're able to, in the spring, identify a method for funding that pilot. So that is it from staff. Commissioners Beach Ferrara and Whitesides and Presley are your representatives who are wearing both hats as a member of the Early Childhood Committee and the Board of Commission, and I pass to anything that you all would like to add.
Thank you, Rachel. I'll kick this off, and then, of course, Al and Robert, look forward to hearing your thoughts. And just want to take a moment to both appreciate and acknowledge the work that the Buncombe Partnership for Children has done, the work that our committee has done, including their unanimous endorsement of these strategies, and of course the work that staff do very diligently year after year as we keep growing our commitments around early childhood. What we wanted to put on the table before sort of having a broader discussion is really a 2-step proposal for consideration as we think about how ARPA funds can be invested in supporting pre-K expansion and working towards that strategic goal around kindergarten readiness. Rachel has just done an excellent job detailing the first, which would be moving forward with funding this 2-year pilot, which really focuses through all these strategies on strengthening the infrastructure of our local pre-K programs, NC pre-K programs specifically, providing immediate benefits to kids enrolled in the program, but also doing the necessary work that could enable that system to scale over time. The second idea we wanted to put on the table for consideration excuse me, would be later in the 2022 calendar year, sometime between now and end of December 2022, releasing an RFP focused on actual expansion strategies. So this would be, funding for both capital and non-capital projects related to creating new classrooms, new NC pre-K classrooms, potentially new NC pre-K centers, and really beginning to put some resources behind the expansion strategies that are described and envisioned here. The proposal to kind of start the conversation is that we would start the conversation looking at a total investment of 7.5 million, comparable to what we're talking about with housing. That would mean 3.2 million invested in a 2-year pilot that could begin as soon as July 1, and then opening up an RFP. That would be about 4.3 million at that point, to actually begin investing in pre-K expansion projects. So that was kind of the full table we wanted to set as we move forward in discussions, understanding, of course, that it will be great to hear other commissioners' perspectives, but wanted to kind of get this in front of everyone, especially as we prepare to head into the ARPA conversations. I think in a way that I'm very excited about and invested in, I think the ARPA funding really gives us a chance to accelerate our work around pre-K expansion. And I think through the combination of a pilot and an RFP that particularly focused on one-time costs and includes capital costs, we could do that in a way that that helps us build towards where I think we can be in a few years' time in this process. So with that, Robert, Al, please jump in with anything else, and then look forward to hearing what other commissioners have to say.
Yeah, well, a big concern of mine has been, we're coming along, this process we've got for pre-K is going great. But I began to feel at this point in time, in some ways, we're continuing to kick the can down the road. But if we're going to get to universal pre-K, we've got to start with the pilot, and we've got to look at really moving toward going to universal pre-K for the county. And I think with the plan we have here, that gets us to this point where we can hopefully get to universal pre-K and be where we need to be for our kids. Because when you look at the numbers, we're only, halfway there with who we're taking care of. Now, I think we have as many who need it as we're taking care of. But this is where I see it, and from looking at it, I look forward to hearing from the rest of the commissioners on that. But it's thanks to the federal money, we're at a good point now where we do have the resources to help move us along quicker than normally we would. And I think we should take advantage of it. It's a good chance. We need it.
Yeah, I totally agree. This is a 2-year plan pilot here, and affordable housing is very important and everything, and we've come so far to let this stale out right now with this pre-K, and I feel like this is the chance that we can see the next 2 years that we can excel. And with what's going on with some of the schools around, I think this is the most important thing. With some of the big manufacturing plants coming in, it just opens a door to maybe down the road to have even more help. So I'd really like for y'all to really consider this. I think it is probably one of the 3 major things we've got working on right now.
All right. Thanks for the presentation. Commissioners, are there any questions at this time?
I apologize if I missed it, but I guess a question for Jasmine or whoever can answer that dollar amount you mentioned, kind of 7.5 ballpark. Does that get us to the eventually to the 75% enrollment I saw on that one slide in terms of serving 473 additional?
It would not. It's
even
a
close?
longer-term goal
Okay.
to basically double our current capacity. We need to double the current footprint to reach the goal of 75%.
Gotcha.
It would be a very serious investment, though. Opening up that RFP later in the year would actually be an infusion of resources that would be creating new classrooms towards the 26 or so additional that will ultimately be needed over the long term if we were to continue to be very serious about this. And I think, obviously there are a lot of conversations to be had. I think at the level we've discussed it so far, it's part of all this is also about us meeting the moment, and it's also meeting our community, right? And really recognizing that we have to, have a lot of communication with local providers about who would be ready to start scaling, what that would look like, Would that mean opening new centers? Would that mean adding on to existing centers, converting, there's lots of different ways you can grow this. And it probably will take a lot of different forms in our community, but our providers are all coming through the pandemic. It's been a very challenging couple of years in the early childhood and pre-K space. So, all that to say is I think down the road, there would just need to be a lot of good conversations about what different expansion strategies could look like.
I have a few questions. First of all, thanks for all the work that you all have done on this, and I just started looking through it today, so I look forward to digging into it some more. You can tell a lot of thought's been put into it, definitely. And so, can you talk a little bit more about, like with the pilot and everything, and how you see this working with what's potentially happening in North Carolina and then also at the federal level, so we can understand how we're being, I think you're trying to be ready for those funds that you hope are coming, but can you speak more to that and how that would work together?
Yeah, great question. I really sort of envision 2 to 3 different scenarios. One is we don't see any major breakthroughs in either state or federal funding. And so we will continue, as other local communities across the state are doing, to really be investing local dollars to move the needle here. Everything about this model still holds under that scenario. What it probably means is that expansion and growth will occur more slowly unless we see major corporate or philanthropic dollars come into the system. Another scenario is that we see at some combination of the state and federal levels, major policy and funding commitments for the expansion of pre-K. One of the reasons that I think this process arrived at investing in NC pre-K as an expansion strategy is because that's a very good way to be prepared for if we start to see a major expansion of pre-K efforts at the state level or at the federal level administered through the states, it will happen in all likelihood through NC pre-K. So one of the things that we spent a lot of time thinking about different formulations of this, and one of the things that was really attractive about this idea of a 2-year pilot was that it allowed us to immediately begin investing and strengthening an infrastructure, and also basically gives us some time to see how these other policy conversations play out at the state and federal level. At the end of a 2-year period, we're going to know a lot more about which of these strategies had the most impact, about which local providers are really able to start thinking about expanding, and we're going to know a lot more about what's happening at the federal level. Specifically, the universal pre-K provisions that had been in Build Back Better, that doesn't exist anymore, but there was a lot of strong bipartisan support for universal pre-K throughout all those extended negotiations. So I think there's a reason to be hopeful that that conversation could be revived at the federal level. And if that happens, Buncombe would be, I think, well positioned within North Carolina to be a county that would be in a great position to move forward with expansion. So,
Thank you for
yeah,
that. That helps.
absolutely.
And then with the pilot program, I guess, so what kind of funding are we looking at? Because the hope is to use ARPA funding, is what I'm hearing,
Yeah.
for the pilot as well as the capital. And then what type of ongoing expenses are we actually talking about with this type of implementation?
Right. Great and important question. Honestly, this commission and future commissions and community will engage with. That was another thing that was attractive about the idea of the ARPA investment in the pilot, is that it creates a 2-year runway of funding. It gives us an opportunity to assess, and at that point have the community conversations we need to about what next steps do we take in our funding for early childhood and pre-K more broadly. All of this would roll out parallel to the annual allocation through the Early Childhood Fund. So that will be $3.8 million this year, approaching $4 million next year. At the end of this 2-year period, if this all works and moves us in a positive direction, I think we'll be at a place to ask the question of, do we increase our overall funding? Do we dedicate a portion of that early childhood funding that's guaranteed year over year for pre-K strategies? Has a conversation with a philanthropic partner or corporate partners or state and federal policymakers advanced to such a place where we know there's another major source of revenue for this? So there's a couple different scenarios we could envision. And there will be, my hope is that this will be an area where we continue to invest significantly as a local community, but we also can't go it alone. And part of this time will be about figuring out what other partners are ready to get serious with us in this. And I hope the answer to that will be many different partners are ready to get serious with us.
And then just one, with the pilot funding, the wraparound services, I was thinking, when we did the original ARPA funding, one of the projects we funded actually
Yeah.
was working on that, right? So-
Exactly.
Okay, so can you speak to that? Is that, since we're already doing that, are you
Yeah.
wanting to scale that up again?
Yep, exactly. So, and that's a great point. For the last 3 years, we have funded many different versions of these 6 strategies at one center, one location, one provider. What we did this fall for Werner with the extended hours is an example of that. We're seeing these are exactly the strategies that are working on the ground. And what this pilot would ask us to do is to invest in being able to do that in a more sustained way and extend that. We know that's one of the barriers with the NC pre-K model. There's a lot that's great about the model, the limited hours or the shortened hours is not. And pretty much every provider that's running NC pre-K runs into the same problem. So we've actually funded some other providers to do that wraparound services as well. So that strategy, the education and career pipeline all speak to things that we've actually been investing in for the past 3 years in a more one-off kind of way, if that makes sense.
Thank you.
No, great questions. The one final thing that we wanted to just make sure to add in this conversation was that we, of course, look at all these questions for Buncombe County children and families, but we also think about our conversations and partnership opportunities with other counties in Western North Carolina, and certainly around issues like the education and career pipeline. There might be some regional opportunities as well to partner with other counties in Western North Carolina as we think about approaches to that. So just sort of planting a flag on that part of the conversation as well as we move forward. And any follow-up questions that folks have, please don't hesitate to be in touch with Al or Robert or me, and appreciate everyone's responsiveness to this and look forward to it being part of the discussion as we move forward.
I actually do have a few questions. I know there's been a lot of them today. Thinking about, and first of all, thanks for all the incredible work. I mean, this is amazing, and the report from Buncombe Partnership for Children is really thorough. Thinking about this as a 2-year pilot and hearing Rachel say, like, this could be ready to go on July 1. I mean, this is February 15th. Has some research and thought been put into which partners are ready to ramp up by July 1? How many teachers and classes are needed? And then thinking in that term as well, are you all thinking as you're reviewing your funding proposals, how those funding proposals potentially tie into a 2-year pilot and a really quick hit the gas pedal ramp up?
Those are great questions. Rachel, you've had a lot of dialogue with the partnership on implementation. Do you mind speaking to the first part?
The strategies contained in the report are not to add actual classrooms or add actual slots. So these strategies will specifically strengthen the NC pre-K system in Buncombe by making it work better for providers to be in the system and work better for parents and families to access the system. And so as North Carolina adds more and more slots to Buncombe's portfolio, we apply for slots to the state each year. Then we have the readiness to add those slots in the future years. So July 1 is not a classroom addition. There are some expansion proposals in the regular early childhood grant funds that were also being considered this spring as in that parallel process.
So for instance, the supplement, if approved, would just start going to local pre-K providers to help sort of lift the level of funding they have basically immediately. The other piece of this that we put on the table, this idea of the RFP that could be opened later in this calendar year, now that would really require certainly discussion and understanding from key stakeholders about what local providers would be ready for in terms of actual expansion and new classrooms or capital costs, et cetera, associated with that. Great question on your second one. And yes, our committee is once again doing amazing work to juggle sort of multiple tasks and timelines at once. And not presupposing where this conversation will land at the commission level, we will be assessing the 24 applications we got last Friday. It's an amazing batch of new applications. And, one thing I would lift up is as we move forward with this conversation about ARPA funding and that conversation, I'm sure there's a way we can make sure duplicative funding would not happen, certainly. But the committee may come forth, for instance, with 2 sets of recommendations based on what the commission decides to do around funding the pilot. Hypothetically, I'm not committing us to that.
Yeah, and I think that then furthers what Commissioner Wells said, is we had looked at previous ARPA applications and wraparound services. As we continue to dig in and look at additional ARPA funding, how does some of those proposals coming forward tie in to this particular pilot? So it feels like there's a lot of funding streams to juggle.
Yeah.
I don't envy that, but thank you all for your work.
No, great questions.
I want to make sure I'm clear on understanding the financial kind of request idea, or, kind of the concepts here. So the idea is we basically maintain the current policy we have around investing in pre-K, the levels we've been at, plus the annual index for inflation. And then the 3.2 million is basically an additional amount of funding layered over and above the base funding to implement this 2-year program. Did I get that right?
The one adjustment is the fund goes to all early childhood education, infant through pre-K currently. But, correct, yes.
I'm sorry, what
So
did I get wrong?
The 3.8 million that we'll award through grants this year, it goes to early childhood education across the board. So
Right.
everything from infant care through pre-K care.
Right,
Whereas the 2-year pilot focus is just on pre-K expansion.
okay, understood. But
Yeah.
basically the
Yeah.
funding is correct, like keep doing what we're doing and then find through ARPA or
Yeah.
somewhere, 3.2 million.
Yeah.
And for that, you get this 2-year pilot project.
Right. And then.
So 1.6 million a year, basically for 2 years in a row to do that.
Right, and then the other idea is through ARPA funding or another source, but ARPA funding would be where the conversation would start. Later, on a later horizon this year, open up an RFP to actually support pre-K expansion projects.
Okay, so it's 3.2 million for the 2-year pilot project. And then the RFP, what's the budget associated with the RFP process?
4.3 million is the idea to start the conversation. That would get us to a $7.5 million funding level from within ARPA funding.
And the 4.3 million would be invested over what period of time? Or that would cover what period of
I
time?
think we would obviously need to work within ARPA guidelines, but it would, so it would be to whatever the deadline was by which ARPA funds needed to be spent.
So 2 to 3 years or somewhere in that neighborhood?
2024,
Yeah.
25.
2026.
2026, yeah.
Or is that sort of to be determined?
No, it
But
would
it's
be
it's
by-
it's basically like, or it would all need to be spent within the guidelines established by ARPA.
Yep.
Okay, so
Yeah.
4.3 million, that would be invested between 2022 and 2025, 26, somewhere in that neighborhood.
On capital and non-capital expenses associated with actually creating new pre-K classrooms.
And the recommendation is that the funds for the 2-year pilot project and the RFP both be funded out of ARPA specifically.
Yes.
Okay. And if, I mean, as we kind of like think further into the future, right? Like maybe a few months ago, we were really optimistic. There's going to be so much federal funding for all this pre-K, like, maybe, a lot of this gets taken care of by other resources. That's now a lot less clear, unfortunately. So if there's not a significant expansion of early childhood education pre-K from the state or federal level, if we approve these ARPA investments in these programs, and of course we hope they turn out great, right? Like we hope that they're like, yes, they did exactly what we thought they would do, they're really successful, then obviously we're not going to want them to go away when the pilot projects are done, right? So if there's not additional state or federal funding, or corporate funding, or some community funding, then, I mean, realistically, then one of the scenarios we need to think about is like, once this one-time funding is gone, these may be things that we just have to, commit to some significant additional county funding to continue, right? So we should just go into that in a really clear-eyed way, right? Like, of course, we hope there's more state and federal
Right.
funding, maybe more corporate funding, but there's a potential that the county, in the long run, will need to invest to make up these, to create permanent funding sources to replace the one-time funding sources.
Right, and when you look at the range of things we're looking at, the annualized recurring cost for this is 1.6 million. So in a bare bones way, that would be the sort of most basic recurring cost that we would be sorry. That $1.6 million amount, which is the amount it costs annually to fund these strict strategies, would be the recurring costs we would be faced with at the end of 2 years if we have no additional investors from state or federal funding, corporate or philanthropic dollars. And one way to do that would be to increase our overall annual allocation for early childhood, add that into the fund. Another way to do that, if we were in a more reticent sort of budget posture, would be to say, okay, we're going to have to just look at the fund and earmark X percentage of the fund just for pre-K purposes. And the fund itself could be used to absorb those costs every year. So we have a safety net of the fund. And then we have this period of time in which I think we can aggressively pursue, hopefully bringing other funders into the mix. We have very little control over what happens at the state or federal level, of course.
But wouldn't we also have to make up, like, if we did everything that's talked about, if we did the 4.3 for the RFP2, absent additional funding sources, we would also have to start picking up, to continue those kinds of activities, we'd have to pick up the annual percentage of that 4.3 million too, right?
I think we could structure the RFP to focus really on largely one-time costs.
More on capital.
More on capital. Yep.
Okay.
Yeah.
Okay.
Or, there's capital, there's materials, you can do a lot around one-time costs. And I think that's a very strategic use of ARPA funds, is around one-time costs. Now that, just to make sure we're being as accurate as we can, that 1.6 number I cited could increase each year because if we're expanding pre-K, it costs more to provide the supplement each year, but it would be a slower step-up process, just to clarify. But that 4.3 is not recurring.
Got it. Okay. Great. Other questions? All right. Great presentation, great discussion. So thanks, everyone. Look forward to talking further about it. Okay, next up, Recovery Act funding. You just put those together. It's no coincidence. I know how this works.
So good afternoon again, Commissioners. Still Rachel Nygaard, still here at the podium, but this time with the agenda topic, continued planning around COVID recovery funding. And so the segue from the last agenda item to this one is that you've heard Commissioner Beachferrara present a recommended priority for potential use of the American Rescue Plan Act funds. And we need to pick up where we left off at the last conversation. So what I won't go into during this presentation is some of that framing and the background. Anyone following along that wants to get up to speed on that can view the presentation from February 1st during your briefing meeting. Today, we're going to ask the commissioners to revisit the topic of the process and the priorities, as well as timing and amounts, if and however applicable, for the next phase of recovery funding awards. You have a sheet in front of you that shows an updated list of allocations to date. That is the same information that's reflected on buncombecounty.org/recovery funding. 27 projects as of February 1st have been awarded, totaling roughly $23.1 million, leaving $27,600,000 $639,791. We are recommending as staff to infuse another $606,000 for fund administration. That's largely to pay the staff salaries, the salary and fringe costs for the grant manager positions, and to infuse some additional funds into COVID contingency to replenish it at the 1 million. The sheet in front of you also shows of the 1 million contingency that was earmarked by commissioners during your August awards, which of those funds have been put toward projects so far. There's 828,000 allocated. So 172,000 would bring it back up to the million. Long story short, around 26.8 million left on the table, which could be awarded to projects. Reminding you of the recommendations that we are bringing forward as staff, that commissioners select priority areas for the remaining funds, and that we solicit proposals, either new or updated, from either community-based or internal proposals aligned with those priorities. This is the list of potential priorities we looked at during the last meeting with the additions that were suggested during that session. So aging and older adult services was added, as was small business support. These are organized left to right by the strategic plan focus areas from education, environment, resident well-being, and vibrant economy. We are asking the board to look at this list, and we're going to come back to it when I'm done talking. Let us know if there's anything that's not on the list that you'd like to see added. Vice versa, if there's something here that you think there's another way of funding that this isn't the best match for right now, we could remove an item from this priority list. We could tweak how items are reflected if we want to make them broader or more specific. We'd also like you to consider, are there any funding amounts or ranges? There's been a little bit of conversation, but not necessarily landing on this, for all or any of the priorities. So affordable housing, early childhood, if the commission wanted to mention a range or a dollar amount you're marking for that priority or for all the priorities, this would be a time that you could do that. In addition, a question or consideration is, when we go out to solicit these projects, do we want to have one process for everything or different processes for any of the priorities? Again, following up on a piece of feedback from last meeting, the idea that maybe affordable housing would be a process that would be separate from the general RFP because of timing. So what we'd like to see as far as next steps is that we've got a finalized list of these priority areas for the next round of awards so that staff can then put together the request or requests for those proposals and to get in touch with the public and our applicants and keep them posted about the process. Lots of our community-based organizations have been reaching out for updates about what the next phase will look like, and we look forward to letting them know what commissioners have decided. So I'm flipping it to the priority list, which is the place that we'd like to leave it as we pass to the Board of Commissioners for your conversation.
Okay, thanks, Rachel. So maybe first question, there's several there. So maybe the first one, let's talk about, are there any priority areas that, some of these are fairly broad, but are there any things that commissioners think of that you might want to advocate for or consider supporting with the Recovery Act funds that wouldn't fall under one of these broad categories that we see here? Okay, great. We're good on that. No, go ahead, Robert.
Okay. I know we're waiting still on the state. I know there's some budget out here for the Inca Candler MSD sewer deal, so I'd like for us to put that on.
Okay. I think one of the categories was infrastructure slash
Where-
broadband. So I think
Okay.
we would be able to definitely consider that, because that would be definite infrastructure.
Okay.
So I think we're good on that, but it's good to say it out loud that that's a specific idea, and I think that would definitely be covered, so we could consider that. Other items?
Chairman, would you like to consider splitting broadband out from water and sewer? Since infrastructure is a very broad term. Roads or bridges or other types of infrastructure.
I'm comfortable keeping infrastructure pretty broad. I mean, there might be some other, I mean, I think water, sewer, that's definitely infrastructure, so I don't think there's any question that that would, like, proposals related to that could be considered. There could be other kinds of infrastructure that might come forward. So I'm okay keeping that term fairly broad at this point, in case there's other ideas that,
I think when we said split it out, right now it reads as if the only infrastructure was broadband, so we're limiting that. I think that's why she was thinking, separate broadband as a category and infrastructure as a category. We can absolutely leave it together.
Not a recommendation, just a question to make sure we're good with how it's worded.
okay, I see the slash as meaning, like,
And/or.
infrastructure means a whole bunch of stuff other than, in addition to broadband. But if we need to clarify, I don't hear anybody disagreeing that we don't want to limit it to just broadband, right? Just for consideration. I mean, we don't necessarily commit to any particular project at this point, but.
So as far as broadband, the funding out there will take county matches to actually bring it in. So it's really important that we leave broadband.
Okay, so infrastructure and other or other broadband initiatives. What about medium-sized businesses?
Business development, business relief.
I mean, maybe we just, again, just in the spirit of kind of keeping things broad, maybe we would say economic development and small business support. Just, again, there might be some things that are not just literally small business support, that might be economic development that we might want to consider. I don't have anything particular in mind, but I think I'm pretty happy with these categories, but I would interpret them broadly at this point so that we don't exclude any ideas that might contribute to these sectors. But I can't think of any others that are not up there that something wouldn't fall within. I guess, you know, in the previous iteration, when we didn't have the guidance on things that would be eligible, and that's turned out to be more permissive. I mean, again, maybe going back to infrastructure, I mean, there were some like greenway projects. I mean, that was something we didn't know about. I mean, I would think of that as a kind of infrastructure project, but maybe that wouldn't be as clear as water and sewer. Parker, you were sort of an advocate for being able to, you know, looking at some of those kinds of projects. I think now we clearly, it's permissible. So do you have any thoughts on that?
Yeah, sorry. I feel like that kind of thing falls under the word infrastructure on this list. And
Okay,
with that.
so infrastructure defined broadly. All right, well, if there's no other categories, just in terms of like the timing and process around this, could you refresh us, Rachel, on I think there was a proposed time frame, a general time frame for proposals to come forward that was discussed earlier. What was that again?
Yep, so what we'll do is put together potentially one single request for proposals which we could release in the month of March. We gave about 6 weeks last time to applicants to submit their proposals and have the review process occur later in the spring, early summer, and have awards ready by the start of the new fiscal year, unless there are any that we want to peel off and handle separately. So as an example, two that I've heard, one was early childhood. If there's an intent to earmark funds for a specific pilot project, commissioners wouldn't necessarily need to put that out to get the proposal written because the proposal is already written. Or another example, if commissioners wanted to peel out affordable housing and have that handled differently because of the turnaround time, we still need projects that are going to be ready enough to implement that they can happen within time frame, but perhaps a little bit longer of a time frame to prepare the proposals or release the RFP. We could set up exceptions. Otherwise, we would do one universal proposal process the way that we did last summer.
Right. So if we went down that path, we could put things out in the fairly near future, and then, so like March and April, folks would send proposals in, and then maybe late April, May, we're reviewing proposals, and for things that have a high degree of support from the commissioners, we start making initial allocations around the projects that are identified as having, broad support on the commission as
That's
early as
right.
May.
And just to reiterate something I said previously, to make sure that anyone listening in hears it, groups that previously submitted a proposal will have a way to update that same proposal rather than having to start the process all over again if it fits in a priority that's selected.
To clarify in your thinking, are you thinking that with affordable housing and pre-K, those would not be part of the RFP that opens up because we already have, because there's sort of work underway that is specific under those areas?
Let's talk about the pre-K early childhood
Yeah.
education first. I mean, in the context of the presentation that the subcommittee made, would the subcommittee's recommendation be that basically is the pre-K early childhood education space proposal to consider, that what we want to do in that space, it's that set of proposals, however much funding we can commit to that.
Yeah,
So basically to make that the proposal for that sector.
yeah.
All right.
Yeah, Robert, Al?
Oh, yeah.
Yep,
I
okay,
agree with you.
yeah.
Yeah.
As a starting point in the conversation, the 3.2 is a very fixed number that we know that could be ready for immediate, begin July 1. I think the question is if
Yeah.
there's a readiness to invest more, the way that we would suggest structuring that would be an RFP at a later date around actual expansion projects. And, that 7.5 million number, it jumped out for a number of different reasons. So that's kind of where we hope to start the conversation.
Okay. So with that in mind, again, not necessarily saying it's going to be this amount that we fund, but if we agreed with that, then would we need to keep, in the solicitation process, we could take basically the pre-K early childhood education out. So we wouldn't be soliciting additional things because we've kind of got a proposed process
Yeah.
to look at.
And we also have 24 other proposals that our community has just submitted to the early childhood fund.
Okay.
So I think we have a lot of incoming content on early childhood funding, yeah.
Okay, so with that in mind,
Yeah, you
is
would
there,
take that out, yeah.
Yeah.
I
so is
agree.
there a consensus we would take out pre-K early childhood education as an arena that we, as a full commission, solicit additional proposals for, with the idea that we're going to focus on the ideas that have come forward and, how much funding, if the full commission would be supportive of towards the subcommittee's recommendations?
Make sure I'm understanding. So what you're asking is we would not be taking any of those proposals in. So we as a commission would not be making those decisions. You're saying you'd be pushing those decisions all to early childhood? I just want to make sure. No, okay.
No, okay,
Okay.
sorry, just that,
clarify.
the proposal around the early childhood pre-K is this pilot project,
Okay,
plus the idea of a RFP.
okay.
That's the proposal for early childhood. We would not open an additional RFP to solicit other proposals around that.
Okay, and so then that would all come to the commission, and then we would make decisions on that with ARPA funding for that.
For that RFP later, is that what you mean?
Well,
Or,
Yeah, for,
And the pilot project.
and the pilot,
pilot.
yes, that would be
Yes.
the sort of,
Mhm.
that
So
would
that
be
would
the
come.
decision, yeah.
then those would be the decisions.
Yep.
Okay,
So I think the idea is like, basically, as it relates to early childhood education and pre-K, we would say, we're not inviting other ideas at this time. Basically, the early childhood education's recommendations that are coming forward, that will be the proposal that we consider as it relates to ARPA funding for investments in that space
Okay.
over the next several months,
okay.
at least.
So we're not making a commitment yet, but we are saying that
We're
that
gonna
is what we're
consider
going to
it.
consider,
Yeah,
those
that
We're gonna consider
proposals.
that. That's right.
Okay, thank
Yep.
you for clarifying.
And if I might, I will clarify with Buncombe Partnership for Children how late of a date is workable for them to be notified of an award for a July 1 start for the 2-year pilot launch. At some point, it will need to be voted on and awarded so that they can take the steps necessary to start launching July 1. And I'll try to nail that down. There's planning that occurs over the next several months. So in the April-May timeframe would be when that would need to be decided.
Okay, and that's for the pilot project, not for the
Correct.
RFP part?
That's right,
Yep.
yeah.
Okay. All right, very good. As it relates to the housing and, I would sort of say housing and homelessness related issues kind of together. I mean, I think the process that Rachel outlined and the timeframe there sounds good. I would say, Commissioner Wells and I have kind of talked about this a couple of times. Like, in general, I would say I'm kind of, is that what I said? How's that? How are you doing that? So.
I don't know.
That was eerie. I think the time frame sounds good. I do think that with some of the affordable housing developments, some of these are big, complicated projects, right? And just, we've talked about, some of these projects the county's working on. We've been working on them for years, right? So I am a little concerned that some of the best ideas for like new projects, it's just not possible for, development organizations or businesses to come up with like a well-baked plan in a matter of 6 weeks when the county comes out and says, hey, we might have millions of dollars to invest. You got to get sites, you got to have a well-planned project, and that doesn't all happen on that time frame. So I would encourage consideration of a potentially longer time frame for that, perhaps, and I'm just sort of thinking out loud a little bit, but maybe we would at least want groups that are going to request potential investments in housing and homelessness to submit some type of application on the same time frame, but maybe we just have we provide some flexibility on how well developed those projects need to be so that we don't exclude some potentially really good ideas, but we also allow a realistic time frame for really good projects to come forward. So that's just a general thought around the housing and homelessness. We potentially, give a little bit more time before making final decisions. Kind of like with the pre-K, early childhood education. I mean, I would advocate for the idea of maybe setting some target for investments around the housing and homelessness category, but maybe with sort of the idea that it's up to a certain amount. I mean, part of it is I would not want to commit to funding any specific sectors too much until we see all the proposals, right? Because, well, I'd love to see us invest $7 or $8 million in affordable housing if we get $7 or $8 million of really excellent proposals, right? And maybe we go through this process and we get $5 million of really compelling projects, in which case I would say, let's spend the other $3 million or in other areas. But my hope is that we do end up with, maybe $7 to $8 million of really solid proposals so that we can jumpstart the affordable housing, efforts in the same way we're hoping to kind of really accelerate some of the other key priorities too. Commissioners, other thoughts around process and timeframes on all this?
I'll just add, I think that sounds good, what you shared about affordable housing, and it actually made me think about with the broadband, it would be good to have a little bit of flexibility too, because the reality is we're ready to go. Our folks have been ready to go, but we have to wait on a very strict state process. And so, again, probably like what you're saying is staff could put in a proposal addressing what needs to happen, but we would have to also wait on some timelines from the state because they're very strict about what we can do on this end in order to be able to maximize the funding from state and the federal funding that comes down through the state. So that flexibility you're talking about could be really useful on that as well.
Alternately, if the whole process, if we want to delay it by a month or two, that would give time for the annual grant processes to be decided, strategic partnership grants get recommended, affordable housing services program allocations for the year to get recommended. All of those awards are typically in the board's budget message and in the hands of the budget office by the beginning of May. We could shift the whole thing. So not too many paralyzing possibilities out there, but we can really craft this in any direction.
Well, why don't we, I don't really see much downside if we've got kind of agreement on, it's this set of issues or, that we're wanting to focus on. Let's go ahead and open it up pretty soon. And, it was kind of an iterative process like we talked about a few times tonight. So I'd say let's go ahead and open the application process soon. Pre-K's given us a lot to think about. But we can start and will there be another process whereby the community groups can send proposals related to these issues? Do we expect the county will internally also submit updated internal proposals related to these issues for our consideration too?
Yes.
Okay.
Yep.
All right. Well, is this enough feedback for the staff to start taking next steps on this?
I see Avril nodding. So I think, yes, you've given us a lot to get started with on the proposal process. So we'll draft up what we heard and bring it back to you to take a look at.
Rachel, can you repeat for me the outstanding balance, 27 million and change?
And change.
Okay.
I don't have it memorized.
Okay, that's fine.
And again, you said once it opens up, you're suggesting a 6-week window for folks to submit proposals. Is that right?
That's what we started with. What I heard was that may not be enough. So.
For some things, at least.
Right.
So our plan would be to go back and sit down and debrief what we're hearing tonight and come back with a plan.
Okay.
You don't have to have us next meeting, but we can share that with you, what our plan and our timeline would look like. Parker, the slide that said what's available is 26.861, so 26.86 million.
Commissioner Sloan, that's with the admin and the contingency backed out.
Taken out.
Yep.
Yes.
All right. Well, thank you for the chance to talk about this some more. It's an important process, so look forward to round 2.
Thank you.
All right. Commissioners, I think that covers everything on our agenda that we had. So let's adjourn, and we'll reconvene at 5 o'clock.